So, what actually happens in an EMDR therapy session? If you've been curious about EMDR therapy, but you have no idea what actually happens in the room, let me walk you through it as a therapist who uses it because what most people imagine is usually very different from what the experience actually is. Or for some of us, we don't even know what to think because we've never heard of it before. Right? So, first, let me break it down. EMDR stands for eye movement desensitization and reprocessing. And that is a mouthful, but here's the simplest way that I can explain it. EMDR really just helps your brain process experiences and still feel, I'm sorry, experiences that still feel emotionally stuck, right? So whether it is in a feeling, like sometimes it's just a feeling in our body that we can't explain, or something traumatic that's happened, or just in like a pattern that you experience. Sometimes we think we've like moved on from something because we don't think about it every day. But then, someone might say something, or a relationship might end, or you get overlooked at work, or you're about to, put yourself out there and take a chance. And suddenly your reaction feels much bigger than the situation itself. And that's often a clue that something underneath still needs attention. So when someone comes in for EMDR therapy, we don't start by jumping into what that thing was that maybe led to like the thoughts or the experiences. Like, we don't get straight into the trauma, baby. All right. We really start at a place that feels safe to you. And we make sure that you feel okay and ready to tell that story. And most of the time, by the time people come to me, and I think that we just kind of sit down and connect and engage and kick it, I think they're comfortable already. And it's easier for us to kind of get to the story. But that's really what's first. We start to get to know your story. And what's happening as you're telling that story is that we're listening. Like, I'm listening for patterns, the places that you keep getting stuck, the situations that seem to repeat themselves, the beliefs that you've developed about yourself over time. Things like, I'm not enough, right? Or I have to be perfect. Or I'm responsible for everyone and all the things, right? Or, I'm not good enough, or this is never going to happen or work out for me. Like, those beliefs didn't appear out of nowhere. Your brain created them to make sense of some very difficult experiences in your life. Even if it maybe didn't even feel difficult at the time, it logged it that way, right? The DVR of your mind recorded some things that's still playing out in your life now, if you will. So, one of my favorite ways to explain it is this. Like, imagine your mind has a closet. Most of your experiences get organized and put away, but sometimes something happens that's too overwhelming or too painful or too confusing. So instead of it getting like neatly filed away in there, it gets shoved into the back of the closet. The door closes, life goes on, but every now and then something bumps into that closet. And suddenly, all of the feelings connected to that experience just kind of come rushing back, even if you haven't thought about it in years. And that's the work that we're doing in EMDR. We're not really forcing you to relive your past and like setting you up to like flood with information and just feel bad about yourself. Like, that's not it at all. But what we are doing is in a very like slow, intentional, I want to say like methodical way, because it's really like an evidence-based practice. It's a practice that's really proven. We are really using that in a very structured way to help you process and reorganize things. And before we even get into that, we start by building the emotional resources that you need to tolerate this work. Right. I think if anybody's just jumping into your story and making you do this work without helping you see that you can handle it, or to give you the tools to cope with it, they're not really doing great trauma work with you, right? Because healing isn't just about opening up difficult memories. It's about making sure that your nervous system knows how to come back safely afterwards, how to be comfortable within yourself again. And only then, when you have those tools, when you feel a little bit more comfortable with that, do we begin to really unpack and process those things. Right? I think most people are surprised that they don't have to tell every detail of their story. I think that's the beautiful part about EMDR therapy for trauma is that you don't have to tell us everything. Even as we do the work, it's just like, give me just a little bit of that. Like, what do you notice? And you don't have to be perfect with the words, right? Your brain actually already knows where to go. And this work is not that you're talking and leading, it's that your brain is guiding you and your body is guiding you, right? And our job is just to help it finish what it couldn't finish when you had that experience in the first place. Our job is to help it get this new information, like this adult big version of you that knows life better. Like we want to get that information and take it back to where you got stuck, where you just didn't know. We want to help you get to know and get to understand. So that's why people often leave us saying, I remember what happened, but it doesn't feel like it owns me anymore. Right? Or I remember what happened, but it just feels so like distant, like far away, and like I don't feel as sad or as disappointed or as bad anymore. Or wow, like I realize I need to just like trust my intuition, or that I already had this in me to do it, but it just doesn't feel so like hard anymore. It's not tough anymore, whatever that is. So if this is something that you've been curious about, if you've been curious about EMDR or you've been in therapy and feel like you've gained insight, but you're still running into the same emotional roadblocks, EMDR may be worth exploring. It probably is worth exploring. I personally specialize in EMDR intensives, which allow us to spend focused time working through the patterns, the experiences, the feelings that continue to keep you stuck, right? And if you would like to learn more, I will include some information about that below. And certainly, if you have other questions about EMDR, leave them in the comments. I would love to answer them in future videos as I make this more accessible to us, because people have been using it for a minute and getting to their healing, and you need to get to yours too. All right, take care, guys. I hope this was helpful.